Okay, I wanted to say just a brief word about ethics and responsibility in assessment. And we'll kind of get to this a little bit more with diagnosis as well. But in terms of using psychological assessment instruments, I thought there were a few kind of key things to just reiterate from the book and kind of expand on a little bit. So we have key tenets in our APA ethics code, American Psychological Association ethics code, and various mental health professions have their own ethics code that kind of relate to this. But a few of the key kind of tenets of ethics for assessment is number one, that we need to have appropriate training to administer tests. So there are certain tests that even me, being a licensed psychologist, I wouldn't feel comfortable and it wouldn't be ethical for me to administer because I haven't had training in administering them. So certain achievement tests or certain intellectual tests or tests of intellectual functioning, I wouldn't feel comfortable administering. It wouldn't be ethical for me to administer because I haven't been trained in administering those. Similarly, there's people who are just practicing counselors, different types of training. That there are certain qualifications that you need to have to be able to administer different types of questionnaires or different types of tests. For a lot of the questionnaires that we've talked about so far, a lot of the basic kind of shorter questionnaires where it's really easy to score. You need pretty basic training to be able to do that. You do need some mental health training, you need some training in psychometrics, but you need less training for certain instruments compared to other ones. When we're doing assessment with people, with clients or patients, we need to make sure that we have informed consent. What that means is that we need to make sure that the client or the patient really fully understands what the purpose of the assessment is. What types of instruments are we going to be administering? What are we using that information for? Again, that usually relates to the referral question. So we may say, this is to help us to get to a diagnosis and to inform treatment, or we may say this is to consider the request for accommodations for this particular type of problem that you reported, or this is related to a referral that we got from your employer, and they're asking us to assess your fitness to return to work or to duty, for example, for military psychologists. So it's important that people know what the purpose of the assessment is and they're very clear about that. It's important they understand what the fees are. That one's more of a logistic element, but again, it's really crucial. And that people understand limits of confidentiality and who will receive the information. So what will the outcome of that assessment be? Usually it's some sort of written report, and who receives that information. Usually it's just the client or the patient if it's an adult. If it's a referral coming from someone else, for example, there are lots of different types of diversion programs out there for alcohol use, underage alcohol use. And so maybe in a college diversion program, maybe, the director of student affairs gets some information on an assessment if that's required. For sports psychology, people who work with athletes, maybe, their coach or someone else will get access to that information. But it's really clear, it's not just the client or that person who's undergoing the assessment has to agree to that. Really, during this process of informed consent, we're saying, here's kind of what is expected based off of what the referral question is and sort of what your employer or your coach or your team or whoever it is kind of needs. Are you okay with that? Do you agree to that? And of course, people can kind of refuse that if that makes sense for them. And who receives the information. So that's really key. And that's crucial when working with children as well, that children and adolescents need to know that what types of information their parents are going to get about them as part of the assessment process and what the clinician will share. It's important to make sure that we're being ethical about how we protect assessments themselves, like the actual materials. So I shared the PHQ-9, the GED-7 because those are publicly available. There are other measures that are copyrighted, proprietary, meaning that there's a cost to them. They're intellectual property of someone, or for certain types of measures that if those measures were to get out to the wider public, that it may impact the validity of that test. So there are certain personality measures, there are certain projective tests, which we'll talk about in a future lecture, where some of them actually you can still find online, but we need to protect the assessments themselves, and we need to protect the testing data, what the results actually are. So I wouldn't just store a client's results or their report on, in my bookcase back there, or have it on my desk, my very, very messy desk that you can't see. But I wouldn't store it here. I would store it in a secure place, or have it stored securely online. We want to use appropriate assessment procedures and tools as well. So again, using things that are psychometrically valid, which I talked about in the last section, making sure we're using the most up-to-date and scientifically based assessment procedures. So again, this is part of the reason why I'm suggesting that, and as much as possible, things like semi-structured interviews should be used. Unstructured assessment procedures they're generally looked upon as being okay, but again, it's something that it's important to be considering, that we want to make sure that we have appropriate assessment procedures and tools. So just to stop off on ethics, and we'll have more on ethics in psychopathology and diagnosis coming up in our next module next week.